Module 2, Gathering Information, Guidelines for Communicating with Clients with Complex Communication Needs. There are a number of reasons why the clients you work with may find it difficult to express their thoughts and feelings or to understand what you are saying to them. In this PowerPoint, we will talk about some of the conditions that result in complex communication needs, and then some good practices for communicating with these clients. Some of your clients may not speak the same language that you do, or at least not very well. A relatively easy fix is to arrange for someone who does speak their language to translate. But translators are not always available, especially in long-term care or in a group home, for instance. Other clients may have severe hearing loss. They can communicate their ideas, but they cannot hear what you are saying. And still other clients have speech and language disorders. For instance, some clients may have a brain injury, perhaps from an accident, an infection, a stroke, or a brain tumor. That brain injury may affect their ability to speak or to speak clearly, or it may make it difficult for them to understand or process the language that they hear. Some clients may have weaknesses or paralysis in the muscles that are used for speech. They may have cerebral palsy, multiple sclerosis, or a tumor or an infection, for instance. These clients might slur when they talk. They may speak very slowly or very, very quietly in a whisper, or they may have difficulty forming their words. Chapter 19 of Mosby's Canadian Textbook for the Support Worker gives some guidelines for communicating with clients with speech and language disorders. Here are some of their suggestions. First of all, schedule extra time to talk with these clients. Doing so can help you avoid getting frustrated and stressed when communicating takes longer than expected. Second, make sure the client can hear you and see you. This means you need to minimize the amount of noise in the background. Close doors and windows, turn off the TV and fans, keep your cell phone on silent mode. Also, sit or stand in a place where the client can clearly see your face. Don't, for instance, sit between the client and the window. Third, get the client's attention and give them your attention. Sit near and face the client. Make sure to look directly into their eyes and make sure that they can look directly at your face. Show you are listening through encouraging nonverbal communication, nodding, gestures. Don't try to do other tasks while you are interacting with the client. Also, be conscious about not being distracting when talking. Don't play with items in your hands. Fourth, think about your own speech habits. Do you tend to speak too quickly or too quietly? Do you mumble? Do you use a lot of slang or figures of speech or medical terms? With these clients, you will need to speak slowly and clearly, but in a normal tone of voice. That is, don't shout or talk very loudly. Fifth, clarify the topic of the conversation. If the client started the conversation, then try to figure out what the topic is. Figuring that out can help you understand what the client is trying to say. If you are the one who started the conversation, make sure to orient the client to the topic before you go into details or start asking questions. Sixth, use simple words, short sentences, and positive statements. For instance, don't say, "It's getting late and I think I'm going to have to transfer you to your wheelchair and take you to the dining room to get your breakfast right away or we're going to be late." Just say, "Let's go for breakfast." Also keep in mind that positive statements are simpler to understand than negative statements. Say, "Go in bum first," instead of "Don't go in head first." That doesn't usually work. Seventh, ask closed questions that just require short answers or nods and head shakes or pointing. Eighth, use verbal and visual cues to support the client. If the client is searching for a word, you might probe. What is it for? Where is it? Can you point to it? Perhaps you can hold up an item. Is this it? Or you could write down the choices on a communication board or piece of paper, and the client can point to their choice. If the client writes better than they speak, they might be able to write on the communication board to get their ideas across as well. Ninth, don't rush the client. Be patient. Pause, give them time to think and respond. Don't answer your own questions. Be willing to repeat your words. Rephrase using other words if necessary. And be very aware of your own nonverbal cues. Make sure you are not looking impatient or frustrated or angry. Are you tapping your fingers on your notebook? Are you looking at your phone or watch? Are you slowly backing away? Is your face frozen? Is your voice tense? Slow down, take a breath, smile, and speak gently. 10. Paraphrase. Paraphrase what they have said and ask if you've understood correctly. So let's look at that table. So you're saying that, did I get that right? Let me see if I've understood. Is that correct? Is that right? So, and last, number 11. Keep in mind that it can be exhausting for someone with a language or speech disorder to communicate. Watch for signs of fatigue and exhaustion, drooping posture, irritability, distraction, and an inability to focus. Allow the client to rest when you see those signs. Although these are suggestions for communicating with clients with speech disorders, each one of these would also be good practices when talking with someone who is having difficulty communicating in their second language. That is, second language learners also benefit from the following: extra time for communication, being able to hear you and see you, having your full attention, slow, clear speech in a normal tone, a clear stated topic of conversation, simple words, short sentences, and positive statements, closed questions that can be answered with a nod or word, using a variety of strategies to get your message across, patience, paraphrasing and confirmation checks, and noticing signs of exhaustion. These suggestions are also relevant when you are communicating with clients who have severe hearing loss. For instance, it will take extra time to communicate with someone who has hearing loss. Seeing your face and your expressions, and especially your mouth and lips, is crucial for these clients, as is reducing background noise. Clients who are hard of hearing also benefit from your full attention. Don't try to do other tasks while you are talking to them. It's important that you speak clearly and slowly, but also that you don't shout or yell. Making sure you state the topic of conversation before you go into details and questions is important. And use cues, nonverbal communication, and other methods of communication to support clients who are hard of hearing. Also watch for signs of exhaustion. One other thing that is especially important for clients with severe hearing loss is to be sure to alert the client to your presence. That is, you need to be extra careful not to startle clients who are hard of hearing or come up to them from behind. You can get the client's attention by raising an arm or a hand when you're starting to talk, or maybe by lightly touching their arm.